morning, everyone. It's 9 o'clock, Sunday morning, our last day of our masterclass, unfortunately. I hope you all had a restful night's sleep and you all had beautiful dreams after this amazing night we had. And just to make sure everyone is aware who is responsible for this beautiful night is our Portuguese member organization, Lara and Nadia. Yes, there is Nadia also. Thanks so much, ladies. It was beautiful. So today we only have half a day, but it will be definitely insightful and interesting. But first, we will hear from Dr. Antonio Almeida, the past president of the EHA. It will be a short video message.
Good morning, everyone, and welcome to the second day of the Myeloma Patients Europe Masterclass. It is really a pleasure to welcome you here to Lisbon, a city where so much innovation has happened throughout the centuries and where more innovation is happening now. As president of the European Haematology Association, I am deeply aware that science does not come from the laboratory or clinical trials alone. It comes from a deep partnership between healthcare providers, doctors, scientists, nurses, and patients and patient advocates as essential stakeholders and partners in this development. Myeloma is probably one of the most dynamic fields in hematology. We have developed many new treatments, new diagnostic tools, new monitoring tools, and so gladly we can all say that patients with myeloma live longer and better than ever before. But we want to go further. We want to ensure that care for myeloma patients is accessible to everybody, regardless of where they live, what healthcare system they belong to. And this is crucial to ensure that adequate care and adequate patient involvement happens throughout Europe and beyond. And this is where our partnership is so crucial. You, as patients and patient advocates, turn your individual experiences, your individual hurdles, and your individual successes into inspiration and collective purpose. And this means that in our collaboration and together, we can truly ensure that we are fighting towards access for everybody and better healthcare for everybody. And so we hope that alongside all the scientific developments we are informing you about, we are really creating a true partnership where every consultation gives rise to joint decisions, to informed decisions, and so that together we really can improve patient care, bring about new strategies, and make sure that myeloma is a disease that we defeat together and collectively. I hope you have a wonderful day, a very productive day, and I look forward to meeting you very soon.
I can only echo the words of Professor Almeida, and that's why it's so fantastic to have this kind of platform where we can exchange the information, knowledge, and experience among the communities, the partners and friends, the patients, clinicians, medical community. So before I introduce the next speaker, just one information. Around 10 o'clock, don't rush out from the room because Linda will have some updates for you about how to organize the rest of the day, etc. And now I would like to welcome our board members and the Vice President, Diana Lenning-Martens.
Good morning, everyone. It's lovely to see you all. And it's such a wonderful evening last night. One feels just so refreshed and full of energy again. I'm delighted to chair this session on a topic that is both essential and sadly very often forgotten with our medical teams: supporting patients and caregivers in managing anxiety. Our evening last night, I had the feeling when we walked into the palace, felt like a princess. I was just imagining how it is, and I thought, isn't this exactly what our patients and caregivers and families need is a little bit of fantasy and fun and having wonderful evenings like this. And I think that does help us with the many anxieties that come with the diagnosis of myeloma and amyloidosis. As Barbara said, I'm the Vice President of MPE, and my wife to Jürgen, who's a patient, a myeloma patient, and together we run a support group in Hamburg. I concentrate on the caregivers, and my husband works together with the patients, myeloma patients. The diagnosis of myeloma and amyloidosis brings a lot of a carousel, as one says, of feelings and emotions and anxieties. And sadly, this is so often, as I mentioned, forgotten in the medical teams, just to ask, how are you? Are you afraid of this? Or perhaps even the medications you're taking. Are you feeling a little bit anxious? Or how are you feeling at all? You know, often it's not really considered. I have great pleasure in introducing our wonderful speakers. First of all, it's Surabhi Chaturvedi. I hope I say it correctly. And we have Andrea Cardoso at the end, and Sarah Tashira, I hope I'm saying. And they're all professionals, all psychotherapists who do wonderful work. I'll start with you as Surabhi. Surabhi is a senior psychotherapist and service lead for the Psychosocial support team in Haemato-Oncology, stem cell transplant and cellular therapies at King's College Hospital in London. And Surabhi specializes in supporting the psychological well-being of patients and their families affected by hematological conditions, and, which I find is really important, provides training and guidance to healthcare professionals on emotional aspects of cancer care. And Andrea Cardoso and Sarah are both psychologists working together with the Portuguese group, APCL. And you have support groups that are online, is that right? So they are always every second week in the month, that's twice in the month. They have online sessions and they are always present, which I find is amazing. So I'm sure you will all you'll have some very good ideas for us how we can support our patients in the organizations. So, Surabhi, the floor is yours.
Thank you. Can I put this on the floor, if that's okay? Yeah. Thanks very much. Hello, everyone. It's such a pleasure and honor to be here today. Thank you to Myeloma Professionals Europe, firstly, for organizing this wonderful event and for inviting me to speak to you. As was mentioned very kindly in the introduction, I'm Surabhi, and I lead a small team of psychotherapists who specialize in hematology at King's College Hospital in London. And I'm going to talk to you today about managing anxiety. So, I mean, it's been amazing. Even on the first day, I saw all these wonderful projects showcased in the poster sessions about what different people have done in your patient communities to support people's mental health. And I'm really looking forward to Andrea and Sarah's talk later about that as well. So what I thought I would do is do something to balance that. I'm going to focus on practical strategies on coping with anxiety and worry. And my hope is that that's going to be beneficial, not just for everyone in this room right now, but that as patient advocates, you can share with your patient communities whatever you find helpful from today as a way of understanding and being able to cope with anxiety and worry collectively together. Because I really believe in empowering people through helping them understand emotions and thoughts and why the mind does what it does, right? So what I hope to cover is understanding anxiety and why we have the type of thoughts we have, recognize when we're feeling anxious, coping strategies for physical symptoms, emotions, and to manage thoughts and worries. I understand that people in this room are from very different contexts. You may or may not have access to specialist psychological support. You might be at very different stages in your own life journeys, treatment journeys, illness journeys. Please take what's helpful and leave what isn't. What I say may not, every single point may not apply to everyone here, okay? So let's start with understanding anxiety. The American Psychiatric Association defines anxiety as an emotion characterized by apprehension and somatic symptoms of tension in which an individual anticipates impending danger, catastrophe, or misfortune, and the body mobilizes itself to meet this perceived threat. Muscles become tense, breathing is faster, and the heart beats more rapidly. Anxiety can be short-lived or chronic. It can be long-term or short-term. We all feel anxious. If you're a human being, you experience anxiety in certain circumstances. I've included a quote by the author Mark Twain up there, which is, "I've suffered many catastrophes in my life. Most of them never happened," right? This is to suggest a very important point about anxiety is that our mind can generate fear and threat that's a response to something real, but it can also do that in a completely imaginary way. And I could be sitting here, I've had a lovely morning, I could be sitting on a bench in the sunshine in Lisbon, and my mind will generate some idea in my mind about what could happen in the future, and immediately my mood shifts. I'm no longer happy and enjoying the sunshine, okay? Right. So just a little bit of kind of technical psychology that hopefully will be interesting to people. So our brains have evolved over millions of years. As we can see in the diagram on the slide, we have an old brain that's very reptilian, that's been around for the longest time, since we lived in the wild alongside other wild animals. And we have a new brain that's developed more recently that allows us to plan and think and imagine and ruminate and have rational thought, etc., etc. Strong emotions that are fear, disgust, anxiety, sadness, joy are regulated by the old brain. The focus of the old brain is survival. The job of the old brain is to just protect us and keep us alive and to respond to threats very quickly. If we think about the fact that the old brain was around when we had to share space and share caves with bears and tigers and all sorts of things that could harm us, we don't really need to sit there analyzing and thinking and calculating what is the risk of me being harmed by this lion that's coming to eat me. It has to be very quick. It's a survival mechanism, right? So anxiety actually comes from this part of the brain. It's designed to come on very quickly because it's designed to protect us. The new brain, wonderful thing. All technological advancements, medical advancements, scientific progress, art, culture, music, literature, all of this comes from our wonderful new brain. But it also has a downside when it comes to being able to imagine threats and dangers. It can make us live through an experience that hasn't happened yet, and it can also make us prolong distress of an experience that has already happened. Let's look at this through an example. This is a deer. It's doing what it does. It's eating grass. It seems perfectly happy. Its body is in a state of regulation. It's meeting its nutritional needs. Suddenly, out of nowhere, there's a predator. Cheetah starts chasing after it. What happens? The deer immediately responds to the threat. Old brain kicks in, which the deer also has, starts running. Its body is in fight or flight. Its body is pumping itself with adrenaline in order to escape this threat, to make it run faster. Happy days, the deer outruns the predator. What does it do? It goes back to eating grass because it doesn't have a new brain, right? If the deer had a new brain, this is what it would be thinking, right? That could have been so bad. What would have happened if the cheetah had caught me? I shouldn't have been eating that grass in the first place. I must have looked so stupid while I was running. I should have known that this would happen, right? So this is just to highlight what happens when we have a new brain. So anxiety can arise in any situation of uncertainty or where our sense of safety is being questioned. This can be physical, but it can also be emotional or psychological safety. If we stay in the old brain, there's a short spike in anxiety which comes down when the threat passes. This is what happens to all of us in response to routine daily twists and turns of life. But if the new brain gets involved, it can make the sense of threat last much longer. It can also recreate a sense of threat and either make us feel like something is already happening when it's not, or it can make us stay in touch with the emotions of what has already happened, even when the situation has changed. So, and again, I can't emphasize this enough. Every single one of us have brains and minds that function in exactly this way. As human beings, we like certainty, we like predictability. Who doesn't, right? Problem is, as everybody in this room knows, life is unpredictable. This is the source of a lot of stress and anxiety for us as people. If we think about the mind as a problem-solving machine, its job is to keep us safe, its job is to predict risks, analyze threats to protect us. What will it do when facing uncertainty? It still tries to make predictions, right? So even if you take a very small example, let's say you're going to catch a train or a flight and the flight is delayed and there's no information available. We'll start making predictions. I wonder whether this will happen. I bet they'll do this. I bet they'll do that. That's just the mind doing what it does. It's trying to solve a problem. Anxiety is a bit like the mind asking, what if? That's a simple way to understand what anxiety is. Some people might get frustrated with themselves. I've heard patients tell me and caregivers tell me, why my mind always looks at the negative side. And what I say to them is that the natural state of the mind isn't a beautiful still pond with water lilies growing on it. That's not what the human mind is like. The human mind is more like a buzzing beehive. Okay? That's what the natural state of the mind can be like for a lot of people. That's not to say we can't learn skills to change that. But I really want to emphasize that when your mind is asking what if and trying to predict and analyze, you're not being negative. You're just coping with uncertainty by trying to predict and problem solve. Okay? So if I go back to what I said a minute ago, that the mind is a problem-solving machine, it becomes easier to understand that it's more interested in things that are not going right rather than things that are going well. Okay? So because there's nothing to solve, that's why it takes more effort for every single one of us to focus on the positives as compared to the negatives, which our mind keeps reminding us of without any effort. This is also why some of you may have experienced this, why our mind pictures the worst case scenario. Has this happened to you, that a problem arises and your mind first goes to what could be the worst thing that could happen? And then it walks back to think about all the other things that could happen before that. Let me give 2 everyday examples to illustrate this point that hopefully people will be able to relate to. So I'm standing up here giving a lecture. Let's say, I get good feedback from 8 out of 10 people. But 2 people come and tell me, I didn't really like what you said there, or I didn't really like the look of you, or I didn't really agree with what you were saying. Perfectly fine for them to do that. On the flight back later today, which one do you think I'm going to be thinking about? These two people who didn't like me. Out of 10, when 8 other people liked me, right? The other example that people can relate to maybe is, let's say your phone rings or your doorbell rings at 3 o'clock in the morning. Are you going to think it's just a normal occurrence and that everything is fine? You're going to think something horrible has happened, right? But that's why, so all of these are examples to show you that this is the way our mind functions. So, sorry, I think I've gone ahead. Yeah, so to summarize, everyone feels anxious. The nature of the mind is to time travel to the future. Our brains evolved this way. It is not your fault that you have anxiety. Part of the mind's problem-solving role is what gives rise to fears and catastrophes. And the reason I've started with this long explanation is I really believe that once we understand why something is happening, it makes it less scary. Because a lot of people I come across are not just anxious, but they're really anxious about the fact that they're anxious, right? Okay. So let's move on to recognizing the signs of anxiety. Have you heard of fight or flight symptoms? Some people in this room might have heard of it. We've all experienced it, even if we didn't know that's what it was called. So that's basically the sense of nausea, butterflies in the stomach, shortness of breath, sweating, increased heart rate. Other features of anxiety are excessive worry that feels hard to control or stop. You can feel quite restless and agitated when you're anxious. People can become quite irritable and impatient when we're anxious. We might not recognize it any other way, but loved ones might notice that you're a bit short-tempered, much more short-tempered than usual. And it also affects our thinking and our information processing. It narrows our focus of attention, where you'll focus on threatening information, because your mind is looking for information that fits with its picture that there's something dangerous happening. And this is really significant for patients in clinical consultations as well, where I think healthcare professionals really need to be aware of this, that if a doctor or a nurse is communicating some information to you about the disease or the treatment, and if part of that information is threatening, the patient or the family member might only focus on that part and might not have heard the rest of the context around it. And that's not the patient or the caregiver's fault. Again, that's because that's what happens in a state of anxiety or stress. The other thing, important feature of anxiety is that it's an overestimation of threat or danger, and it's an underestimation of our ability to cope with that danger. This is important to remember because worry alone is not enough to cause anxiety. If I have a problem but I know that I can solve it, I'm not likely to feel anxious about it. Anxiety comes when I underestimate my ability to solve that problem, or I feel that the problem is beyond me to solve. Okay? Physical symptoms. Recognizing and accepting anxiety is a really important first step in managing it. Step one of doing this is, and I honestly do this myself, is I go, okay, I'm feeling a little bit anxious. I did that this morning actually, because I was feeling a little bit anxious before giving this lecture. I was like, I'm feeling anxious, that's okay. It's normal. This acceptance prevents the anxiety escalating because I didn't say to myself, I've got to stop feeling anxious before giving this talk. If I had done that, the anxiety is only going to go up because I'm putting more pressure on myself. So when you notice fight or flight, or when you're supporting people who are experiencing anxiety, just say to them, you're having a moment of anxiety, that's okay. It immediately relaxes our nervous system to say that. The other thing we can do when we're in fight or flight, that's still on that slide. When we're in a fight or flight mode, it can be really hard to change our thought process or change how we're feeling emotionally. But one thing that remains in our control, and this is an easy way to manage anxiety, is controlling our breathing, because our breathing controls what our nervous system is doing. So practicing a soothing rhythm breathing technique where you take regular slow breaths and focus your attention on your breath is a really great way of bringing up the parasympathetic nervous system, which regulates that fight or flight. Should we try a breathing technique together now? You don't have to do this if you don't feel comfortable. It's just an invitation to take part. So if you just sit in an upright but relaxed posture with your hands either uncrossed, not in a tense position, shoulders down. You can close your eyes if you feel comfortable. If not, it helps to just at least focus your gaze not on somebody, but down below. And I want to just invite people to start by slowing down your breathing and taking a slow, deep breath. In through the nose and out through the mouth. And just carrying on breathing in a slow, deliberate, soothing rhythm. And I want you to focus your mind, your attention on what the sound of the breath is that it makes as it travels in and out of you. A sound that only you can hear. It's your own inner music. Slow down your breath and just notice, as if you're noticing your breath for the first time. Continue to breathe in through the nose and out again through the mouth or the nose. Just telling yourself it's okay to take a moment and just breathe. And let's just take one breath together. And as you exhale, open your eyes and come back to the room. That's a super simple technique. Another technique we teach patients that's really easy to grasp and actually is a bit more technical, but that's helpful to people when they're feeling anxious, is box breathing. Have you heard of box breathing or square breathing, it's also called? So we can practice that. So what I'm going to ask you to do is I'm going to ask you to breathe in for a count of 4. I'm going to ask you to hold your breath for a count of 4, breathe out for a count of 4, and hold your breath again for a count of 4. Okay? It'll take a few goes to get into it. Again, you don't have to do this if you don't want to, but it's an invitation to try it, right? So I'm going to ask you to inhale for 1, 2, 3, 4. Hold 1, 2, 3, 4. Exhale 1, 2, 3, 4. Hold 1, 2, 3, 4. Let's go again. Inhale 1, 2, 3, 4. Hold your breath 1, 2, 3, 4. Exhale slowly 1, 2, 3, 4. hold 1, 2, 3, 4. Let's go again. Inhale 1, 2, 3, 4. Hold 1, 2, 3, 4. Exhale 1, 2, 3, 4. And pause again for 1, 2, 3, 4. Now you can breathe normally, right? So that's another technique that you can try where you're just deliberately focusing on the breath, which can shut out some of the other noise in your mind when you're feeling anxious. How do people find that kind of? Yeah? Okay. And again, different things will work for different people. You can also use meditation apps, other people guiding you. Basically, the idea is try and control your breathing to stop those fight or flight symptoms. The other thing we can do is focus on something external to you. What anxiety does is makes us go inwards into our own thoughts, physical sensations, feelings, projections. An antidote to this is to find something outside you to focus on. This can be in the form of either a positive, gentle distraction, like music or a hobby, or even work sometimes is a good distraction for anxiety because people feel more anxious when there's lots of time to think about things. Or something where you're creative, where you're using your hands, but where you're not having to think a lot, like jigsaws, knitting, crochet, golf, whatever it might be. Another way to focus on external stimuli is mindfulness. Who's heard of mindfulness? Right? We've all heard of it. Sometimes I'm a little bit wary of how many people have heard of mindfulness because I think that it's used as if it's a solution to all problems. So hopefully I can present mindfulness in a slightly different way. So mindfulness is simply put a way of having present moment awareness, using our 5 senses rather than our thoughts. Because anxiety is always about what could happen, it has a future focus. So learning to focus our attention on the here and now can be a useful skill to practice when our mind is time traveling into a future point. And it doesn't have to look like getting out a yoga mat and sitting in lotus position. That's not what mindfulness needs to look like, right? You can bring mindfulness to any activity you're doing, whether it's just cooking or whether it's walking, whether it's doing the washing up, whatever it is you're doing. The idea is that you try and really notice what you can see, feel, think, see, hear, touch, feel, taste, and smell. You could even do this in the room. A great way to practice mindfulness is to just look up at these beautiful chandeliers and try and notice how many different shapes there are. That's a simple way to practice mindfulness. Or if you're in a room, count how many right angles you can see. These sound really strange and weird, but they really work because the mind is forced to focus on what's happening right now. So I've put a 5 senses mindfulness exercise on the screen, which you can bring to any activity. 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, 1 thing you can taste. It's a great way to access the present moment. Majority of people report that doing that gives the thinking mind a break. So think of our mind as operating in 2 gears. One is the thinking mode and one is sensing mode or being mode. One is not better than the other. We need both of these in order to survive and thrive. But we don't drive our car in the same gear all the time, right? I mean, for those of us who still have cars with those manual gears especially. But, and that's why it's really important for us to learn to be in a different gear from time to time. So it's just about mindfulness is just one way of switching gears to go from thinking mode into just sensing mode and present moment awareness. Right, and if we move on to managing emotions, I'm going to show you a video that illustrates a point that's really important in the world of psychology, which is called emotional acceptance. What happens to us as human beings is we think of some feelings as bad feelings, feelings we shouldn't be having. So as soon as they crop up, our instinct is to push them away. No one's ever won a battle with our emotions, I can tell you that much, right? It's a very hard battle to win. The harder you push, the more the emotion will come. It's like trying to hold a beach ball underwater. So the next video, which is by Dr. Russ Harris, who's an Australian psychologist, shows this point really wonderfully. Let's see if hopefully that works. How do I get it to play? There we go. Somebody's helped me out.
It often seems like we've got a struggle switch at the back of our mind, And as soon as an uncomfortable emotion, a painful feeling or memory shows up, it's like the struggle switch goes on and we start to struggle with it. So let's suppose anxiety shows up. Very common, painful emotion that we all get to experience. Anxiety shows up, the struggle switch goes on. Oh, here's anxiety. I don't like anxiety. I want to get rid of my anxiety. Now I've got anxiety about my anxiety. So it's getting bigger. With the struggle switch on, I now get, oh, my anxiety is getting bigger. How do I get rid of my anxiety? Now I've got even more anxiety. With the struggle switch on, I may then get angry about my anxiety. Why is this anxiety keep showing up? I hate this anxiety. Then I might even start to feel sad about my anger. Oh, is this my life? Oh, and then I may start to feel guilty about my sadness about my anger. Oh, how pathetic am I when there's starving kids in Africa? So with my struggle switch on, my emotions get amplified. I've now got guilt about my sadness, about my anger, about my anxiety, about my anxiety. And that kind of amplification of emotions gives them more impact and influence over my life and often gets me bogged down or pulls me into self-defeating behaviors. Now, what happens if I can switch off the struggle switch? With the struggle switch off, anxiety shows up, and it's not that I like it or want it or approve of it, it's just I'm not going to struggle with it. I'm not going to invest my time, energy, and effort in struggling with this anxiety. Instead, I'm going to invest it in doing meaningful, life-enhancing activities, such as spending quality time with my friends and family or playing with my kids. Now, with the struggle switch off, the anxiety is free to move. It may get higher, it may get lower, it may move quickly, it may move slowly, but the point is it's free to move. It doesn't get amplified by all of these other emotions which make it kind of bigger and stickier and make it hang around for a lot longer. So there's no such thing as a life without anxiety. It shows up for all of us. But when anxiety shows up and the struggle switch is off, it's so much easier to live with than when the struggle switch is on.
Right? What did people think of that? I think it says it better than I did, frankly. Okay, so just to say a few more things about emotional acceptance. Sometimes when I talk about emotional acceptance, people say, are you just telling me to give in to my feelings all the time? That's not what it's about. As the video illustrated, we're just stopping the struggle so that the feeling's not getting amplified, which then puts us in a better position to be able to deal with the feeling and use all the other coping strategies we're going to talk about today to deal with it. And actually, it doesn't just apply to anxiety. I would say the struggle switch applies to every single emotion we feel that we find uncomfortable or difficult, including grief, loss, sadness, all of which is very present in the world of any cancer, right? Self-compassion. Another thing that psychotherapists love to talk about, but people receive it in a very mixed way. Self-compassion is another helpful strategy for any down days or moments. Whenever you experience a moment of distress or you're supporting somebody having a moment of distress, ask them to think about what they would say to a friend or loved one in exactly that situation then and there. We're all kinder to other people than we are to ourselves. This is true. In a way, it's nice. But in another way, it means that we have a way to access a more kind, compassionate, wise voice when we're struggling as well. I'm going to also ask you have to actually say those words to yourself in a kind and gentle tone. This is the part that feels weird to most people, but it really does help. Because what we need to hear when we're feeling vulnerable doesn't change whether it's me or whether it's you. And I know instinctively what I would say to comfort someone else. That's exactly what I need to hear as well. Sometimes you just need to stop and say, it's totally understandable you're feeling like this. That's okay. It's particularly helpful when we need to move through strong emotions that we can't just wish away or make disappear. There was an expert in stress reduction and mindfulness. His name was John Kabat-Zinn, and he had this wonderful quote. He said, if you can't stop the waves, learn to surf. And the better we get at surfing, the smaller those waves feel. Right? Let's move on to thoughts and worries. And like I said before, I know I'm throwing a lot of coping strategies at you. You don't have to remember all of this, okay? I said earlier that a lot of anxiety is driven by the mind asking what if, what if, what if. Writing down your thoughts and confronting the what if questions is a great way to manage the thinking part of the anxiety. It focuses the mind when we have to clearly define what is the fear. Sometimes we can feel anxiety, but we don't actually know what is it that we're afraid of. Doing so can help us separate irrational fears from rational fears, because we'll have both. It also gives us that little bit of distance, which helps to look at them slightly differently. Writing things down also helps to organize our thinking. We like organized clarity, we like lists, so if you make a list of everything that's on your mind, that list will stop. Whereas if it's swirling around in your mind, it's going to be like a hamster wheel with no end. Okay? So what we want to do is we want to translate diffuse generalized anxiety into focused constructive worry that we can then deal with. What happens when we're in a state of anxiety is we ask a lot of questions, but we don't answer them. Why don't we answer them? Because the question's scary, right? Totally understandable. Sometimes your mind will ask a what-if question that feels really, really frightening, and of course you want to run away from that. But running away from it just makes it scarier. If you keep running away from a question your mind is asking, your mind will keep asking it. If you turn around and confront the question, you only have to do that once, and the mind will stop, because it wants to protect you. It's saying, why aren't you thinking about this scenario that could happen? And if we keep running away from it, it'll keep asking us. It's not going to stop. So the thing is that our minds can time travel, but we can only influence events in the present moment, right? So even if it's a scary question, it can ultimately reduce anxiety and help us feel more in control. For example, if you're living with myeloma or amyloidosis and you're having the question, what if I go on holiday and I get sick while I'm there? Something that stops a lot of patients I meet from planning holidays or doing things. If you just ask that question and leave it hanging in the air, of course it's going to make you feel anxious. There's this scary scenario that's hanging over you, and you haven't thought about how you would problem solve it. What if you try and answer that question? Okay, what would you do? Immediately the patient knows what they would do, right? They would go to the nearest hospital, they would contact their healthcare team, the answer is there. It's just that you haven't turned around to actually confront the question. If it's a future worry, ask yourself, what can I do about it right now? What preparations can I make to safeguard myself against that future worry today? Even if it's painful and scary to do that, it can make us feel more in control. And if you can't find something to do right now to deal with something that might happen in the future, let's say you're being planned for the next line of treatment, which is maybe a little bit more intensive, or it's new, your mind might ask, what if I get side effects? What will they be like? Unknown, 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 anxiety. Tell yourself, okay, there's nothing I can do today about something I don't know what it's going to feel like tomorrow. I will deal with it when it happens, right? And the thing is, you've all done this. You've all done this without even realizing you've done it. The other thing that can help is to soften our beliefs. Rigid beliefs, very strict rules about how we should be, they increase our psychological distress. I need to know in order to cope. I need to plan. I need to be in control to feel okay. I have to make the right decision. We're constantly putting a lot of pressure on ourselves as human beings. But are some of these assumptions actually true? Can you think back to a time in your life when you didn't know something in advance and had to deal with it when it happened? I'm sure everybody in this room can do that, right? So what helps is if we just soften these beliefs into slightly more adaptive versions, gentler beliefs that reduce that sense of threat. Not knowing is uncomfortable. It's uncomfortable not to know how the side effects are going to affect me. But I can try to work with what I know so far. I'll try to plan as much as I can and deal with the rest as it happens. There's no perfect answer or decision. I can only make the best decision based on the information I have right now. It really helps to guide our mind to think like this rather than going into rigid rules. All right. The other thing that can help is to shorten your time frame and control the controllables. Anxiety is directly related to how big a time frame we look at. If you look at the next day, you'll feel less anxious than if you try and look at the rest of your life. That's not just true if you have a serious illness, that's true of all of us, right? And people with myeloma, people with amyloidosis, or both, experience so much powerlessness and loss of control. People, you're having to adapt to situations all the time. It can be helpful to remind yourself that while big questions about survival, remission, relapse, treatments might not be in your hands, the small questions are. Ask yourself, what can I do here and now? It can even be really small things like, what am I having for dinner tonight? Or how am I going to spend my evening? Or what am I going to do tomorrow? When your mind becomes stuck on what's going to happen, ask yourself, what do I know now? What do I have now? How do I honor this? How do I invest in this? This gives the mind something really clear to focus on when you're feeling like the ground is really shaky beneath you. And it gives you a direction of travel for the short term. Having small daily goals, routines, or rituals also really helps with mood, whether it's depression or whether it's anxiety. Whether it's a daily walk, whether it's aiming for getting up in the morning and getting dressed every day when you're really struggling physically, staying connected to people and activities that matter to you also helps. Sometimes there are external barriers to us being able to do what makes life feel worthwhile, but sometimes we can give up on things that make life feel worthwhile because of our mood, and that's the part I'm trying to suggest a shift in. We all need achievement, connection, and enjoyment. We use this acronym ACE to sort of teach people this coping strategy. And this can look very different depending on what's going on. If you're having a really tough day physically, it can be something super small like, I've got up and got dressed by 11 o'clock in the morning. If you're having a great day and going through a good phase, it might be, I've done a bit of work today, I feel really good about that, or I've done my whole garden because it's springtime. So these can look very different. Connection could be something super small like sending a text to a friend or a loved one going, how are you doing today, or should we meet for a coffee? We all need achievement, connection, and enjoyment. I'm going to add an S at the end of that ACE to make it ACEs. Soothing is really important as well. What I mean by that is find something that that induces a feeling of calm and relaxation in you. Again, this is different for different people. For some people, it's being with animals. For some people, it's being in nature. For some people, it might be doing something active. Or being in a quiet space. Just take some time to think about what are your soothing strategies. Notice the small wins. Sometimes we can focus a lot on how we're feeling rather than what we actually did. I had a patient tell me she was post-transplant after having had myeloma treatment, and she went to hospital alone for the first time without her husband there. And she's having a session with me, and she's talking to me saying, Surabhi, it was horrible. I just didn't cope. I was panicking. I had to call my husband. And I said, okay, so what happened? What did you do? What ended up happening? She's like, I eventually made it. I was like, so that's what happened then. You made it. Sometimes we can really focus on how it feels rather than what we did. So keeping a record of small wins really helps, because what we want to do is we want to look at how I dealt with the day rather than what the day did to me, right? And doing so, you can, no matter how tough your day was, if you have that perspective on how did I do, you'll feel like a survivor rather than a victim of circumstance. And that can be really empowering. I'm just going to wrap up after saying a little bit about anxiety interfering with sleep, because this is a big concern for people. I often meet patients who have sleeping difficulties, which causes more stress and anxiety, which affects your sleep, right? Sometimes we might, we're constantly told how important sleep is to our well-being. The first thing I do is to say that all the advice you read about sleep being important to well-being is for the general population who are not, and it's about, chronic sleep deprivation isn't good for us. But actually, it doesn't apply to the fact that, if you have one night where you can't go to sleep, you should stress about it. Really important to emphasize that. Like with emotions, struggling against not being able to sleep hardly ever works. So again, say, you know what, I'm not able to sleep today. That's okay. I'm not driving heavy machinery tomorrow. It's fine. I'll be a bit tired, but it's okay. Unless, of course, you are driving heavy machinery, in which case you might need to revisit that. Aim for rest rather than sleep. Rest is in our hands, sleep is not. So what you could do, and again, I'm sure you're all aware of this, but basic sleep hygiene really works. Don't drink caffeine after a certain time if you know it affects your sleep. I went against my own advice yesterday by having a coffee at dinner yesterday. So I don't always follow my own advice, but broadly, try and avoid caffeine. What really helps if you're struggling to sleep and your mind is going is listen to something which has people talking. Not just music, because music is familiar to you. Your mind is trying to solve a problem. It's wrestling with something. If you play a song that you know really well, it's going to be like, I know this, I don't need to pay attention to that. Give it something to listen to that it has to focus on, an audiobook, a podcast, Obviously not about upsetting things like true crime and all that. I don't get why people are into true crime podcasts. I'm not. But so give it something to distract it. Sometimes that can help you fall asleep because the mind has suddenly stopped wrestling with the problem it was dealing with. We often forget that as human beings, we can choose to focus our attention on something positive. And I know a lot of patients have tried this and have told me it works. So, if you can't go to sleep, deliberately try and think of something that lifts your mood, whether it's a film you like, or whether it's a comedy show you like, whether it's a happy memory from a long time ago. Try and bring that up in your mind. That's, again, New Brain is fantastic. New Brain can help us think back and imagine those things as well, right? If you find that you have lots of thoughts keeping you awake, keep a notepad near your bed. Write down, I need to do this, I'll do it tomorrow, 9 o'clock. Your mind will stop worrying about it because you've done something. You've reassured it that we will deal with this problem tomorrow. Big one for me, I used to have sleep problems as well. It really helps not to look at the time if you can't sleep. Because sitting there calculating how much you're not sleeping is not helpful, okay? Really important message I like to get across is rewrite the script you have about yourself. As I mentioned earlier, anxiety is an overestimation of threat, underestimation of your coping. So in the last part, I want to focus on how we change this tendency we have to underestimate our skills. Let's do a show of hands. Is there anybody in this room who has had the experience of every single thing in your life happening exactly as you wanted? You've had things happen exactly as you wanted? Yes. Including like you've never missed a train, you had flight delays? But have you had a time when something didn't happen exactly? Right, that's my point, right? Yeah? But it's very nice to notice when things do go our way. But there's literally no one in this room who's had a life where something happened as you wanted all the time. Is there anyone in this room who has never, ever, ever, ever had to deal with a crisis that you weren't expecting? Okay? Is there anyone in this room who had to deal with a really shocking, upsetting, unexpected situation, but here you are and you've clearly dealt with it? Right? Lots of hands going up? This is my point, and this really is such an important point. We are all, and you can say this to patients you support, we are all more resilient than anxiety makes us think we are. We've already had to deal with unexpected challenges, and the fact that you're here means that you're survivors and you have the skills to cope. Notice I'm not saying that you didn't feel upset, or feel scared, or feel shocked, or feel shaken up. You're allowed to feel distressed, but it's an undisputed fact that you're resilient because you're here. I'm an evidence-based practitioner. I don't believe in affirmations that are not true, okay? So what I'm saying to you right now, that you're all more resilient, you're all more capable than you think you are, is not some fantastical idea. It's literally a fact because it's already happened. And this is really helpful when we're facing questions that we can't answer and that even our medical team can't answer for us, right? When we come across such questions, it can really help to remind yourself, I'll face it when it happens because I've done that before. And when you do that, you're giving yourself that little boost of confidence that you need. I'm just going to end by saying there are so many patient advocacy organizations. This whole meeting is about the wonderful work that patient support organizations are doing. You might need additional support. You might need to speak to somebody else who's been exactly where you were 2 years ago. All of that really helps. There's also specialist support that might be available to you if you speak to your medical teams about it. And we're going to hear about projects that patient support organizations are doing. I'm going to end my talk there, and I'd be very happy to take questions either now or together later. Okay, thanks very much for listening.
So good morning, and thank you for being here. My name is Andrea, and together with my colleague Sarah Teixeira, we are clinical psychologists and psychotherapists at APCL, and we are briefly present our work on emotional support groups in multiple myeloma. So this work is part of a broader program called APCL Cares. It includes individual psychological support groups, and buddies program, peer support. Between 2024 and 2025, we supported 58 people across different regions of Portugal. And many patients use more than one component, creating a continuous support system. Why this is important, special after this lecture, because psychological support is still not fully integrated in oncology care. Patients face emotional challenges to go behind medical treatment, and this program helps provide ongoing emotional and psychological support throughout the illness journey. Research over the past 20 years show that support groups are effective. They are usually structured, time-limited, and focus on emotional regulation and coping. They often include psychoeducation and stress management strategies. Studies show that support groups reduce anxiety, depression, and improve well-being of patients and caregivers, strengthen coping skills. They are also cost-effective and valued by both patients and professionals. So, what is this? Our model is based on one idea: emotional support is part of cancer care. The group runs for 10 sessions every 2 weeks, 9 minutes, most of the time 2 hours. It's the really time, and with small groups. And it is online and combines learning and share experience. Why do patients join? Because they experience uncertainty, anxiety, and changes in identity. The group helps to reduce isolation, increase connection, and promote empowerment. And this is the core. The work is about something simple, not facing the illness alone. The group is structured but is flexible, so it's a closed group format. We use a closed group with 3 phases: beginning, middle, and ending. And we also offer follow-up sessions and WhatsApp group for ongoing support, even when the groups are finished. So these are the topics we talk in the different sessions: adaptation to illness, emotional regulation, anxiety and stress management, and self-care and priorities. Here are the implementation of the groups. Each group has around 8 to 11 participants, and we also added complementary sessions such nutrition, social support, and grief. And here we have the timeline since we begin, and now in May we start the 5 group. And the results, what we have seen about these 4 years. Participants report better emotional expression, improved coping, and less isolation. And they also describe a strong sense of connection, belonging, and support. And now I pass to Sarah, who will present limitations and future directions.
Thank you, Andrea. Good morning, everyone. Even though our results are encouraging, we need to be clear about the limitations. First, our sample is still small, and the groups are quite diverse: different ages, disease stages, and treatment phases. Also, in the beginning, we didn't use standardized psychological assessment before and after the intervention. And we don't have a control group. So we can say for sure that the changes are caused by the intervention. We are also mostly looking at short-term outcomes. So we don't yet have a strong long-term follow-up data. Okay? Another point is a selection bias. Patients who join these groups are usually more motivated and emotionally ready. And finally, this model depends on a specialized clinical psychologists, which make it a research intensive. So what are we doing next? First, we are introducing a standardized psychological assessment before and after the intervention. Second, we are expanding this model to caregiver groups that, because their needs are also significant and often overlooked. We are also developing a structured training program so other professionals can safely replicate this model. And finally, we are exploring digital and hybrid formats to improve access. So, to summarize, emotional support, it's not optional, it's essential. This group model is feasible and can be scaled, offering patients connection, meaning, and practical tools. Going forward, we need to focus on evaluation, training, and expansion. And most importantly, psychosocial care must be integrated into clinical oncology if we want to improve patient-centered outcomes in multiple myeloma. Thank you. We will finish with a quote from one of our participants. In the beginning, it was me, then came the group and showed us that no one has to face this path alone. Thank you.